Cosmetic surgery in Australia is booming like never before. We have overtaken the US in plastic surgery procedures per capita. Now a method combines the practice with another fad. Our love of all things organic. Organic plastic surgery uses the body's own fat for augmentation or improvement, taking it from parts of the body where it's not wanted and injecting it into other areas. Here to explain the procedure is Dr. Tamara Hunter. Tamara, good afternoon to you.
Hi, Tomo.
This isn't just about transferring fat from one part of the body to another, but is more to do with stem cells. How does it work?
Well, it's interesting because cosmetic surgery and plastic surgery are often used interchangeably, but they're quite different. Cosmetic surgery is more for the improvement of appearances, whereas plastic surgery is more for repairing defects and normalising things. So this is part of cosmetic surgery, and a lot of people worry about the use of implants and fillers and synthetic products. And so it's become a little popular because it's deemed to be organic because you're transferring a patient's own body fat from one part of the body to another part of the body to improve contouring. And associated with that is the adipose-derived stem cells, which are actually thought to just prolong the viability of the graft and make it work better.
OK, now this is obviously sold as a more natural, healthier alternative to artificial implants or substances. What's your take on that kind of marketing?
Well, I think it's probably been subjected to the greenwashing that we see a lot in the wellness revolution, where companies choose to brand things as organic or environmentally friendly. The use of fat transfer or autologous fat grafting, as it's often termed, has been used for quite some time. And pleasingly, the Australian Society of Plastic Surgeons actually just terms it as fat grafting. It is quite a safe procedure, minimally invasive, often done under regional or local anaesthetic, and is quite acceptable. So I think that calling it organic fat transfer or plastic surgery might be a little overkill.
Yeah, it looked to me, and just tell me if I'm wrong, there seems great irony here. There is something we don't quite like cosmetically, but we want to change it. Nature, we don't quite like the way it is there, but we'll try and change it naturally, if you know what I mean. It's artificial nature.
Right.
Doesn't quite fit. Am I seeing it the right way?
Oh, I think that it's probably been termed or couched rather that it's acceptable to what is trendy right now, which is that whole terminology of greenwashing.
Yeah, now nothing is risk-free. Are there any worries about the procedure?
Of course, with any cosmetic surgery, like any surgery, there is healing, scarring, infection, inflammation, pain, damage to surrounding structures, and just undergoing surgery itself, deep vein thrombosis, cardiovascular risks. So it's really important to have informed consent when you go through any cosmetic surgery. Tamara,
really important question. I think a lot of people look at this and would ask this. We mentioned the extraordinary boom in plastic surgery here. As a doctor, do you have any concerns about the explosion, especially about how regulation is keeping up with it?
Well, it is interesting that we are said to now outrank the Americans as far as plastic surgery goes, some 500,000 cosmetic surgical procedures over the last year. Now, the term specialist plastic surgeon is a protected term by our governing body, APRA. 12 years of education, an additional 5 years of training beyond that, and accredited surgeons under the college. Well, the term cosmetic surgeon, though, can be used by any medical practitioner. It's not a regulated term. So it's really important that consumers know the difference. So I would always suggest that they go and sit with their GP, discuss what it is they want to achieve, and then follow appropriate referral pathways to a specialist.
OK, so what you're saying that you've got to be careful.
Yeah, there's a variety of skills and training.
OK, interesting times. Tamara, thank you so much, as always.
Thank you.